4, 3, 2, 1.
Good afternoon and welcome everyone to the next Ask the Experts COVID-19 virtual town hall. This is our 5th town hall now, which has become really popular in highlighting different faculty expertise here at Chapman. My name is Tom Piechota. I'm the Vice President for Research here at Chapman. I'll be moderating today's town hall, where we have another great group of experts talking about a real diverse group of topics. It's always great to hear about the different status of what's going on, talk about the current issues. We hear a lot about it in the news, whether it's about Governor Newsom and our local officials talking about the optimism of opening up the economy, people being anxious to get out of their homes and start to do some of the things that they haven't been able to do. It's been almost 2 months now, and certainly I think everyone wants to be able to start doing some of the things that they haven't been able to do. Chapman certainly has continued to support our students, and it's been interesting and also exciting to hear some of the activities of our students. This time of year we always have our student research symposium. This year we did it virtually, and it was really interesting and exciting to hear our students in this type of format and talk to them over the last couple of days. From all across campus, so it was great to be able to hear from them over the last 2 days. We're planning for the next year here in terms of how to get back to school, and I will say also it was really great over the last week to see the community support. Our university advancement had over 1,300 donors raise $1.1 million, so it was really great to see the support raised by our community. Today, we're going to be talking about, again, another great, interesting group of experts talking from the economic issues of COVID-19, some of the social issues. We're going to be hearing from someone talking about the writing of COVID-19, and then some of the efforts from how this is impacting our students. Some of the logistics of this, the format that we're using. We really want you to be engaged in terms of asking questions. That's a real important part of this. So on the right-hand side there's a question and answer part. Right now you can actually start asking questions if you want of our presenters as they make their opening remarks. So post those in there. We'll be either responding to those directly or getting to those as part of our question and answer period here in the second half. And so with that, let's go ahead and get started with our first presenter of the day. Our first presenter is Mark Weidemeyer. Mark is a professor of economics and finance in the Arduous School of Business and Economics. One of the really interesting things you're going to hear from Mark today about is something that he's been working on. He's worked on for a long time, is something called the Consumer Sentiment Index, which is really a great indicator of consumer buying in our community and how that's been impacted over the last couple months here from the coronavirus. So with that, I'm going to turn it over to Mark for his short presentation.
All right, thanks, Tom, and thank you for everyone for tuning in today. I'm going to talk a little bit about consumer sentiment in the state of California and also in Orange County. Now, in the United States, consumption spending accounts for about 70% of all economic activity. It's by far the most important component of economic activity. And so one of the sort of questions that economists want to look at is they want to understand whether people are optimistic or pessimistic about the future. And so what they've done is they've constructed consumer sentiment indicators. Consumer sentiment is designed to try to gauge the psychology of consumers and how do they feel about buying things today and into the future. And so we've built Chapman and Claremont McKenna College have joined forces to build a consumer sentiment index for both California and for Orange County. Now, the surveys are random. Okay, they're based on, we try to collect a survey that mimics what the census looks like in California and in Orange County. And the goal is we ask 7 questions 7 questions about economics and finances in your finances and how they are today in the future and how do they compare versus last year. And then once we get all this data together, we can, from the 7 questions, we can construct an index. And so that's exactly what we've done. So what I'd like to do is basically give you an idea of how COVID has impacted consumer sentiment, okay? And then discuss what the implications of that are for consumer spending. So if you look here, I have the California Consumer Sentiment Index, and you can see that it dropped from 96.9 to 82.6. Now, that's almost a 15% drop. Now, the issue is that this is based on the first quarter of 2020. Now, what you have to remember is we sample our data all during the entire month. There's there's 2,000 respondents in the survey, and we have a 15% decline over the entire month. However, if you limit our sample to 500 and the respondents that were asked in the last week of the month, you get a much different story. Once stay-at-home orders started putting in place, we see a 47% drop in consumer sentiment. Now, what does that mean? Well, that's a really low number. That's a recession number. Anything certainly in 50s, it's the lowest reading we've ever had in the California consumer sentiment. And it says that consumers are, they're not like too happy right now. They're very pessimistic about the future, and they're unlikely to open their pocketbook and, put out a lot of money to buy goods and services in the economy. So it's a big negative for consumption spending going forward. Now, the next one we have is Orange County consumer sentiment. It dropped nearly 20%. Now, the sample size for the Orange County sentiment survey is only 500. So we couldn't take the last week because we don't have enough data, but we still registered a 20% decline. And so again, these numbers raise significant questions about our consumers once we reopen the economy and we have, many people are unemployed. There's a prospect of losing jobs. Whether or not people are going to go out and spend money, and which would have the impact of bolstering economic activity. So the numbers right now don't look too great. And the future, there's a lot of sort of uncertainty and a lot of different moving parts. We have are there going to be, another wave, a second or a third wave of the coronavirus? How are businesses and consumers going to do when we reopen and people go back to work? On the other hand, some people are getting paid to work for businesses which are closed. Are they going to continue to have their jobs? So, we see, I think in the near term, things still look very uncertain. And there's a lot of questions about whether or not the consumer side of things is going to improve over the next couple of months. Thank you.
Great, thank you, Mark, for that interesting and obviously probably concerning information on consumer sentiment. I want to remind all the people watching, please feel free to ask questions. We're gonna have plenty of time at the end for questions of our experts, and you can start posting those now. But at this point, I want to move on to our next presenter. Our next presenter is Tara Gruenwald. Tara is a associate professor and chair of the psychology department in the Crean College of Health and Behavioral Sciences. Tara is also one of our recent awardees of the COVID-19 Rapid Response program that was supported by the K Family Foundation. And she's going to be presenting some of her work on the potential harm to mental, physical, social, and economic well-being from the COVID-19 pandemic. So with that, I'm going to turn it over to Tara.
Great. Thank you, Tom, for that introduction, and good afternoon, everyone. Well, I'm a health and social psychologist by training, and one of my long-standing research interests has been trying to understand the health impacts of stressors and stressful conditions. And I think everyone would agree that the COVID-19 pandemic is a stressor, but there are certain features of this pandemic that really make it unique, even among major stressors. And over a century of stress research has really shown that there are specific characteristics of situations which make them very potent stressors, which means make them very likely to affect our emotions, our thoughts, our behaviors, and our body's physiologies in ways that are really relevant for our mental and physical health. And the COVID-19 pandemic really has a number of characteristics that often make that sort of top 10 and even in some cases sort of that top 5 characteristics that really sort of get us activated as humans. So we know that obviously the pandemic is a threat to our physical integrity. It has the ability to make us very ill and even threaten our life. It also has the ability to sort of limit our access to essential resources for survival, like economic resources, food, and shelter. But then layered on top of sort of this threat to our physical integrity, it's also a very cruel threat to our social well-being, in that it impairs our ability to connect with others because now others are a potential contagion threat. And if that wasn't enough, even though we're learning every day more and more about the viral threat, there's still a large degree of uncertainty, unpredictability, and uncontrollability as it regards the pandemic and its consequences. Now, any one of these characteristics on their own would be enough to make the COVID-19 pandemic a serious threat. But when we combine them together, they sort of make a perfect storm in terms of the ability of this threat to elicit stress-related pathology and affect our mental and physical health. Yet, despite this incredible potential for harm with the pandemic, we are really presented on a daily basis with examples, both large and small, of individuals and organizations really stepping up to help one another and work together to combat the pandemic and some of its negative consequences. Whether it's those of considerable resources, donating money and time or other resources, or those of really more modest means coming together to make sure that people have the food and supplies they need to survive, we know that individuals and organizations are really responding with significant prosociality, meaning they're engaging in behaviors and having orientations with the sole goal of really working to help one another and assist one another. And
Sarah,
yeah, sorry.
I'm going to interrupt you. You forgot to share your screen.
Oh.
We're not seeing your presentation there.
I have an option to not share. Okay, I'll try again.
Yeah.
Can you see it now? You could have let me know, Tom, before.
Sorry, I was just.
Can you see it now?
Not yet.
Okay.
Hmm.
I was sharing, I unshared, so now I'm resharing. Now can folks see anything?
Can't see it yet.
Okay. It had given me a window that an error. Mark, are you still sharing by any chance?
You wanna continue, and we can move on, and we'll make sure we share your presentation, or we will post your presentation if you don't just talking to it.
Okay.
We'll make sure we post it on the website. I apologize, and we can, if you want to talk through it, we can make sure people get that, and we'll post it on the website.
So you can't see anything, is what you're saying?
Well, we see you.
Oh, well,
Yeah.
thank you.
Yeah.
Okay, I'm not sure.
So you can continue with your presentation.
Okay. So as I was saying, we know from past studies in pandemics and natural and man-made disasters that this prosocial sort of behavior that we're seeing is not uncommon. It's been observed in other pandemics and also in other disastrous situations. And my research has really been focused in my own work, not necessarily related to the pandemic, but trying to understand some of the benefits of prosociality, not just for those who receive the sort of help and assistance, but also for the givers themselves. And so, for example, my work has shown that those who provide assistance to others and those that give to others in a myriad of ways actually have better mental and physical well-being, and actually sort of weather stressors better than those who don't show such prosocial orientations. And so I've been very thankful, as Tom pointed out. I am a recipient, along with a number of my colleagues, of a K Family Foundation Rapid Response Grant for the COVID-19 pandemic. And one of the things that we're trying to sort out in this grant is trying to understand how prosocial orientations and prosocial behaviors might actually help individuals to better weather the pandemic and actually promote more adaptive coping. And so we just recently launched a nationwide survey where we're going to be looking at about 2,000 individuals across the US over 3 times over a 4-month period. So from April to August, which is sort of the early months of the pandemic. And what we're trying to understand is how folks' orientations to really reach out and lend a helping hand might actually help them themselves better weather the pandemic threat. And so I would be showing you some lovely statistics. I don't know why I've tried to share a bunch of times. We actually practiced this a bunch of times. So I don't know why it's cutting me off. But what I would be showing you right now, if I could, are some stats showing that we've surveyed and looked at data from about the first 1,700 people that we surveyed at the end of April. And what we're seeing is that individuals, we have a low number of people who actually have a coronavirus diagnosis, although a more decent chunk that have experienced coronavirus symptoms. And then about a quarter of our respondents are actually frontline workers, and about 40% of our respondents have a household member who's a frontline worker. So we have folks who are experiencing sort of the day-to-day of the pandemic. And one of the things that we're finding is that folks with more prosocial orientations, so folks who have greater desires to help others in meaningful ways and are more empathetic and sort of respond to people's experiences, we're finding that those individuals are actually engaging, as you might expect, in a greater rate of pandemic-specific helping behaviors. So things like making masks and buying groceries for those in need, comforting people who are distressed by the pandemic, and then volunteering in pandemic-related activities and organizations. But on an individual level, these individuals are also showing emotions and thoughts and responses that we know actually facilitate more adaptive coping and adjustment to major stressors. So they're much more likely to report that they feel like they can successfully cope with the pandemic, that they can gain a sense of control over the things that they need to do. They're more likely to say that they feel a greater sense of connection with others because of this threat, and that they've derived some sense of meaning, or that they perceive they will in the future, and also that they think that some good will come out of the pandemic. And so all of these are orientations and responses that we know are adaptive under different types of major stressors. So I had some beautiful graphs. I wish you could have seen them. We'll make sure that they're available to you all. But the bottom line is that we're really, really thankful to have this opportunity to try to understand how orientations towards helping others might not only engender folks to engage in behaviors that we need them to engage in to cope with the threat of the pandemic, but might also help individuals and their families really weather this perfect storm of threat that the pandemic represents. So be happy to answer any questions in the Q&A. Thank you.
Great, thank you, Tara. And I will say, looking at the Q&A, a lot of people didn't even realize that you needed a presentation. You were doing such a good job. So,
that's very sweet.
I know that was very nice. And and again, we will post your presentation because you did have some really good information. We will post that for people so they can look at that. And I appreciate you making that presentation without your slides. So with that, I want to move on to our next presenter. Our next presenter is Anna Leahy. Anna is a professor of English and the director of the MFA in Creative Writing program in the Wilkinson College of Arts, Humanities, and Social Science. And Anna's going to talk some about the way writers have been affected by COVID and responding to the global pandemic. So we're going to go in a little bit of a different direction with the presentation that Anna's going to be making. So with that, I'll hand it over to Anna.
All right, thank you, Tom. Today, I want to talk about 3 ways that writing in the pandemic are playing out: science writing, general nonfiction, and poetry. And it's important to separate or distinguish science writing, which is for the wider public, from scientific writing, which is writing about research by the scientists doing the research for other experts in that field. And one of the reasons I want to say that these town halls seem to work so well is that Chapman University is full of experts in their field who are also teachers in the classroom. So they're used to working with students who are not experts yet. So we have an awful lot of good communicators on campus among our faculty. In addition, we're an extraordinarily interdisciplinary campus. And so I think this town hall format and bringing different disciplines to bear on a particular subject is really typical of Chapman. To go on to some examples of science writing as opposed to scientific writing. To my mind, Ed Young at The Atlantic is doing some of the most important science writing of this pandemic. If you haven't read his stuff, go there after this presentation. His latest piece, for example, addresses the important differences between mutations and strains in viruses. And that's something that, say, political reporters at White House briefings wouldn't have the expertise to interpret, even if that's being discussed in the briefing. So a lot of this science language in our media requires some expertise in translation, otherwise it causes confusion, and we're seeing that as well. I also want to distinguish the kinds of science writing like Ed Young's from what readers might see at a publication such as Scientific American, where they assume that readers already have an interest in science, or Science Magazine, which is even more specialized. We also might think about how the language is changing in the pandemic and how the language of science and epidemiology and public health has now become part of our more general vocabulary. I didn't know what social distancing was in January, but I sure know that now. To move on to nonfiction, we see that it can come in many forms, which often depends on how much focus the piece has on the writer's own experience in relation to how much the focus is on the world that the writer is experiencing. So here are some examples that you might want to take a look at. There's a profile, for example, of 8 mothers and how they're coping with the pandemic and the stay-at-home restrictions. That's online now at the New York Times, and it'll be in print this weekend for Mother's Day. And Senator Tammy Duckworth is one of the women profiled, but she's the famous one in the bunch, and the profiles are really about a variety of different kinds of mothers. A good example of cultural commentary in this category of nonfiction is Paisley Rekdal's piece on the misuse of the term Chinese to describe the coronavirus. And Rekdal is a poet laureate of Utah, and the article can be found online at the Salt Lake Tribune. So if you want to start looking at the differences between different kinds of nonfiction and how they balance the personal and the cultural. One example of the more personal essays that's coming out about real life experiences with COVID-19 is Leslie Jameson's piece at the New York Review of Books. Again, that's available online as well. The journal Another Chicago Magazine recently launched a new online series of short essays. So it's 2 to 8 paragraphs, very short, very quick reads that blend personal experiences with the pandemic and also include commentary about what this pandemic means to our culture. And each piece has a different sort of balance between this personal and cultural. And then there are also diary projects, both public, like those at the LA Times or Business Insider, and private diaries that individuals are keeping just for themselves. Social media, I want to point to in particular, because it's sort of in between this private and public kind of diary. And we're seeing a lot of physicians and nurses sharing their experiences there in a sort of diary-like format. Finally, I want to talk about poetry, which is near and dear to my heart. Carolyn Forche has been a presidential fellow here at Chapman University for several years. Her latest book just came out. It's called In the Lateness of the World. And of course, she and other writers are publishing these books that they wrote long ago, and they're now entering the world during this pandemic. And hers is particularly relevant for these times, I think. In a recent interview at pen.org, she says that poetry is the natural prayer of the human soul, and that's why people have always turned to poetry in moments of extremity. And I think the pandemic, we can agree, is a moment of extremity. This week's, excuse me, this week's big poetry news is that Jericho Brown's book, The Tradition, was awarded the Pulitzer Prize in Poetry. It's an amazing and important book that I hope will shape the literary canon. It's not directly about the pandemic, but I think it's important to realize that other things are still going on, that literature, culture, music, it's all continuing and maybe feeling more important than ever. There are numerous responses specifically to the pandemic by poets and by poetry organizations, and I'll point to only a few. If you search for the hashtag International Poetry Readings on Twitter, you'll find lots of videos of people reading their own poem sometimes, or a poem by someone else. And I'm really happy that the guidelines for that project now include a request to tweet the text or a photo of the poem as well, so that low hearing readers and viewers can participate. Local projects are also popping up. I just found one down the freeway in San Diego, and they're collecting poems. To conclude, I want to share a call for book spine poems for pandemic times from Tab Journal. Tab Journal is a project that Claudine Yanishin, our information designer in the art department, and I head up, and it's staffed by our MFA and creative writing students and some alums. The idea for this project comes from an art project by Nina Kachadorian in 2013. So this isn't a new idea, but we've applied it to the pandemic. She stacked books, one on top of the other, and you can see the three pictures there of other people's, including my own. She stacked these books so that their titles then become lines of a poem. It's sort of a half found, a half made poem. And we're encouraging anyone with a personal library who's under stay-at-home orders to give this a go. Tab Journal is considering submissions through June 15th for one of our fall online issues. Probably they'll be published online in September. And I think that is about it for me.
Great, thanks, Anna. All right, thanks so much. And I want to go on to our last speaker now. Our last speaker is Daniel Tomaszewski. Daniel is an assistant professor in pharmacy administration in the biomedical and pharmaceutical sciences department in the School of Pharmacy. Daniel is also an awardee of our COVID-19 rapid response program from the K Family Foundation. And he's going to be talking some about a project that they have looking at student well-being and campus experience and how that's been impacted from COVID-19. With that, I'll turn it to Daniel for our presentation.
All right, I'm getting a little note that my network quality isn't ideal. How are you hearing me, Tom?
You sound great.
Oh, perfect. All right. I was going to say, never fails. Your network can work great until you actually have to present in front of a large group. So, well, thanks for having me. And really, what I wanted to talk to you today is a project that I'm working on with a couple of colleagues, and I'll be highlighting them later. But really, when we think about what the coronavirus pandemic has done and COVID-19 has kind of transitioned our individual lives, it's really changed a lot about how we live and how we interact with the world, as well as our day-to-day job. And the next question then is, on our academic side of things, we're experiencing big changes, but what are our students experiencing? A great example of just the difference in life today is, I got up this morning, got right to work and playing catch up on some stuff, and I had a little, break then at lunchtime, and I went to jump in the shower, and my wife says to me, "Why are you taking a shower?" That question would not have existed, in our lives 2 months ago, because that's just how things have changed so drastically in our personal life. But then if you think about how we're teaching students and how we're interacting with students, we've also had a substantial change in what we do. And, when we think about student life today and what it's going to look like post-coronavirus, our group wants to ask that question. What is this pandemic going to do to how students are interacting with the campus community? What is it doing to their individual circumstances? And how is that all boiling down to impacting their ability to learn in a fashion that we expect them to, so that they can be successful, graduate on time, and be a quality, members of our community moving forward? And how do we make sure that they have appropriate management of stress and well-being and everything that comes with a pandemic that we often, I think, are feeling as faculty members and individuals going through it ourselves? And as I was talking more about this with colleagues at the School of Pharmacy, and then branched out and to other individuals at Chapman University overall, the question is, this is different than really other things that have altered what campus life has looked like. We think about it, is it like similar to a disaster reaction, a tragic event that happens at a campus? Is that how students are reacting to it or will react to it? Or does this extended time frame really change how that impacts the student response? I just think when we first announced that we were going virtual to our students, some of them were excited because it frees up their time frame, and they can do this online learning platform that they you think would be it makes life easier for them on the front end. And then as the overall time frame has expanded out, many of those students are realizing, the short-term pieces that help them and make their life a little bit more convenient on the teaching side and not needing to go into campus are quickly, swapped out for, I'm not getting to spend time with my colleagues and my students, my fellow students. I don't have a good connection with my faculty members during this response, and my overall student life has been completely upended. And we've asked our faculty to alter teaching substantially to make sure that we continue to find a way to make sure our students are learning what they need to learn. And I think about myself, and the challenges that I've had in that process really have to do a lot with my current life circumstances, right? So I have a 2-year-old, soon to be 3-year-old in the house, and that has substantially impacted my efficiencies that were typically there. And it's also made it so teaching to students requires me to think about, where is my kiddo going to be when I'm trying to lecture, so that the student interaction isn't disrupted. And it also has brought students into a much more personal component of my life, having direct access to the back of my office, or viewing my at-home office, viewing potentially a presentation in the garage. And so, it changes their dynamic and their perspective of who a faculty is and how they interact with them. And a big component is, if we think of ourselves when we were students, the change in the student life and the living situations can be, a very dynamic piece. If we look at anecdotal reporting, personal living situations for individuals, we think, oh, well, dorms closed, students go home, they'll figure it out and they'll be just fine. That the problem is, home may be, across the country. Home may be international, and home also may mean that they're heading back home to a place where they've got many brothers and sisters or family members that require their attention and needs. And so it can really change overall how they can learn. And so we started to ask the question, how is that going to turn around and impact student outcomes and their overall learning and well-being? And so we built out a theory. I work with Dr. Brooke Jenkins and Julia Bem, and we have been working towards building out a theoretical model to take a look at how do the psychosocial resources that our students have access to, including those that Chapman is doing to try and provide to students as much normalcy as they can during this time, how does that interact with their stress, and then how does stress lead to overall mental and physical health, and how does that impact student learning outcomes? In particular, how are our students doing? What are their impact to GPA? How are they reporting their ability to learn during these times? And how does that all turn around and funnel through their emotions, social support, optimism, and coping? And the resources we're providing, are there certain items that really help us out to mitigate some of the concerns that maybe this coronavirus is creating? And then secondarily, the reality is, do we know how much this is impacting the students? And I think it's a very one-to-one individual student interaction that is and response that we're seeing. We think about the student that has a big family at home and the challenges they may have, or that may have financial concerns to start with. This may, heighten those financial concerns and may turn around and impact both their personal economic life as well as their capability to learn. And versus the student that is not in those situations and has a private apartment or something that has created a good work environment, may experience something extremely different. And then the last thing we really understand is that maybe our undergrads are experiencing this very differently than our graduate students. I'm, very tied into the health sciences campus, and so our PharmDs, PAs, PTs are very much experiencing that differently than maybe our undergrads are. And trying to take a look at what those differences look like. And we were talking a little bit about, the wonderful things that our student pharmacists in particular are doing, because they're out there working in community pharmacies, hospitals, health systems as part of their APPEs, their experiential education that they're doing, and they're able to actually be part of that front line to help impact positively patients, both in COVID-19 overall, but just general well-being and health of those patients that are out there. So their experience may be very different than those that are more geared towards spending the time in the classroom, because you have additional stressors for being out on the front line, but you also maybe get a lot more satisfaction in what you're doing out there, still working with the community. So what is a pharmacist doing this work? That's a great question, and that's why I've got some wonderful colleagues, and I apologize as I see this slide, I spelled Brooke's name wrong. I'm missing an E there. But Brooke and Julie and I have been working on this, and we hopefully will have some preliminary data to share shortly. But we are we are very appreciative of the K Family Foundation for supporting this work, and hopefully more to come.
Great, thank you so much, Dan, and thanks to all our presenters for the really great presentations. Thanks to all the participants for posting a lot of great questions. Our panelists have already been answering a lot of those, so I see a lot of great conversation going on. Some of it I might repeat a little bit just so everyone gets a chance, because I think there's been a lot of good conversation, a lot of good questions. I'll try to get to as many of these as possible in the next 22 minutes here. I'll keep us right on time. The first question I want to ask is for Tara Gruenwald and maybe others too, because I think it may touch on maybe some of the things that Dan just said. But I think it was an interesting question someone posted on a New York Times opinion piece where they compared what was going on with COVID-19 with gun violence. And I think that the broader issue is of acceptance. And I think the acceptance over time, that society over time, there's probably let's just call it a decay in acceptance of the numbers that we see on TV every day, in death, which is just terrible, but I think there's a broader acceptance of that, and the parallels between COVID-19 and gun violence, and what are there psychological underpinnings of that, and are there parallels between that also that we should be looking at, you know?
Yeah, it was a really great question. And as I responded in the chat as well, I can see the parallels between what we often refer to as the epidemic of gun violence in the US, and then what we're seeing with the pandemic. And anytime you have a situation in which the strategies and solutions seem insurmountable, or, you know, the threat is so large, as I pointed out is the case with this pandemic, you know, we start to become helpless. But I think the trick is, as folks in the behavioral sciences and every other field that's impacted by this threat, and there are many, as we've been talking about, is really to try to identify those aspects of whether it's the epidemic of gun violence or the pandemic of COVID-19, what aspects of that threat and problem can we engage in solutions to try to combat and address? And how do we facilitate and encourage and engage individuals in those efforts? And which elements, you know, are we less able to modify, and therefore other forms of coping, such as a gentle acceptance, or at least a gentle acceptance of those things that we can and cannot control, would be adaptive. And so I think that's really, you know, the pandemic is going to call on us all to think about what are the things that we can do, what information, knowledge, expertise can we engage and leverage, and we have to engage. The threat is significant, but we also have to help people distinguish between those things where we should focus our energy and those things where maybe it's not the best idea. So yeah, I think it was a really, really great parallel to point out, and I thank the questioner for raising it.
Dan, I want to maybe kind of related to that, but more from the student side of things. I know you're just beginning your study there, but someone had asked the broader questions of the biggest stressors of people on this pandemic, whether that's the stressors of having to do social distancing, the stressors on the economy and how that's impacting them, the stressors of health concerns for their own personal health concerns. There's a lot of different stressors. What's your sense in terms of, from the student standpoint, and I know you're beginning your study there, but what's your sense in terms of if you had to kind of rate or kind of hypothesize what you think those largest stressors are for students? What do you think what's that going to look like when you look into that, when you see the results? You know?
Yeah, you know, I think that there's going to be multiple answers to that same question, right? Because in the short term, students are relatively short term in nature. If you think about them, right? They're thinking about exams next week or what's happening with their friends and family in the short term, not normally thinking that longer term perspective, like what's going to happen to the economy that's going to turn around and impact their well-being and ability to go to school. But I think that that's going to change over time as well, right? So in the short term, I think you're going to see a lot of reports of the social distancing aspects having increased stressor. I think there's a subpopulation you're going to see that their living situation being disrupted is going to turn around and be a significant stressor. And you're seeing this reported out in the high school space in particular, where they're trying to transition to at-home learning, and you lose a pocket of that population because they just don't have a living environment that's conducive to learning. So I think, you know, living situation, social distancing is going to be the short-term piece, and then the bigger piece is going to be, as this continues on, the economy is going to start to weigh on them, a realization when they're looking at graduation dates, what's that going to mean to them in the job market when they finish up. And the same thing goes for particularly the students that are closer to graduation. I think about our health science students, you know, trying to think about a job market that they're going to be entering into that, you know, maybe at the same time an economy is in peril. So I think those things are going to change as time continues on as well.
Great. Did anyone want to add to that or the previous questions? I know, Anna, you had mentioned that you might want to add to one of the questions I had asked.
Well, I think that Tara gave a really good answer about that comparison and making analogies, but I think we have to be really careful about the analogies we make, so that when we're talking about this COVID-19 pandemic. When we say gun violence, we're bringing a whole lot of baggage into the conversation, and a whole lot of preconceived opinions as well. And if I use that analogy, I may be talking about one very specific aspect that might be similar when the whole thing is very different. So I think that is really important to be careful about making these quick analogies, especially when we're so early into this whole pandemic understanding and mindset.
Thanks. Mark, I want to ask you what everyone wants to know, really, and I know you were responding to some of this in our chat, but I think everyone wants to get your view on this. So the economy, everyone's talking about opening up the economy. How do we do that in a safe way? I guess I have a couple things that I'd be interested in. The dramatic drop that you saw that you're seeing in the consumer confidence, it is dramatic. I guess a couple things. Have we seen things like that in the past? And I want to be careful about drawing bad parallels, as Anna said, but have we seen dramatic drops like that in the past? And what do we need to look out for to come out of that? Obviously, you touched on some of those things we need to look out for to come out of and bring back consumer confidence. There's going to be various variables, and I think you touched on some of those also. But what is it's going to take us to get us back to those high levels that we saw earlier this year?
Okay, well, to address your first question, the drop that occurred in the California index and basically in a month, okay, was what the data would indicate, or 2 months, is unparalleled in the history of consumer sentiment indices. Now, I have to qualify that because consumer sentiment indices are a product of the post-World War II period. But if you were to venture and say, well, what does a drop like that look like? The closest thing is probably the Great Depression. Okay. Now, typically, if we see a recession, what does it look like? A typical recession look like in a consumer sentiment survey? It's something that kind of happens over 6, 7, 8, 9 months. Not something where you just see someone essentially jumping off a cliff, which is basically what the California index tells us. And the numbers from Michigan, from their weekly survey, are saying a similar story. And so, this looks, if you want a historical analogy, it's most likely the Great Depression. Now the question is how do we get out of this? Now my guess is that hopefully the 50% drop, we're at the bottom of for the first wave anyway of the coronavirus. Hopefully that is the bottom. Okay, you would expect that the numbers would go up somewhat, a little bit, given the large stimulus package that the federal government, both in terms of fiscal policy and monetary policy, in terms of giving aid to small businesses and giving aid to people who are on unemployment insurance. Okay, so the issue is that how much longer can the government kind of try to prop things up, and can they sort of help things out and get us over the hump until the private sector gets back on its feet? That's kind of the real question. And are they able to do? Are they able to do that? They sort of just help us get over the hump. And the question is can they help us to get over the hump for a long enough period such that the private sector is in a position to sort of take over? And then so that's assuming there's only one wave. Now, if you look back at the pandemic of 1918, the lessons, they have some good lessons from the pandemic of 1918. Now that was more severe because it killed roughly about 2% of the world's population, which is about 50 million people. The lessons from that, they had 3 waves. Okay. Now, hopefully we don't have that, but that's a whole another can of worms if we have 3 waves. But there's also lessons from social distancing. From the 1918 pandemic. There's a recent paper out by some MIT economists basically showing that areas in the United States in 1918 that took aggressive action and implemented, basically no gatherings or not big gatherings, and implemented basically forms of social distancing back then, performed better in the long run than areas that didn't. So the West Coast generally fared quite well because coming out of the pandemic of 1918 relative to some other areas, because the West Coast was pretty aggressive in limiting physical contact among people. So, so the implication of that, at least from the implication of the 1918 pandemic, at least from an economic standpoint, is you have to be careful not to open up too soon. If you open up too soon, at least the data from 1918 going forward into the 1920s, the areas which implemented social distancing earlier and also maintained it tended to fare better in the long run than places that opened up too soon.
Great, thank you. I'm going to try to touch on other really interesting questions that people are posting, and I may be stretching some of the expertise of our experts, but that's okay. That's why they're on here, right? So I think this is an interesting one. So I think people's religious lives have really been disrupted. People have to watch their religious services remotely. They're not engaging in the same way. Or religious traditions have really been changed. Does anyone want to comment on kind of the impact that has had on kind of their lives, and if that's something that you're looking at, whether that's from the psychological standpoint or from the religious tradition standpoint or from the religious writing standpoint, and if that's something that we've seen before,
I'm happy to comment on that one. I'm not a psychologist by any means stretch, but I grew up in the Bible Belt. So I grew up in North Florida, and I come from a fairly religious family. It's bothersome to me. I typically go to church every week, and I don't do that anymore. And it's something that I enjoy doing. Now I realize that that's not everybody does that, and that's great, that's fine. But for me personally, yeah, I mean I would like to be able to go back to church. Mm-hmm. And it's and I don't feel very safe going, because the church I go to has 7,000 of members. Right.
Yeah.
Tom, I think this was also directed to me, and my reading of the questions was that in some of what I was speaking to, there was the teachings of the great religious traditions, and I apologize to the questioner for my ignorance if I'm misunderstanding, but I'm assuming something along the lines of we see playing out in many of our religious traditions to think about do unto others as you would have done unto you, and really that our religious institutions, Mark, is probably really reacting to the fact that a big part of what brings us comfort from religion is not only in helping us think about how to navigate challenges, but also the fellowship part of that. And like I said, this stressor in some ways is incredibly potent, because it's a physical threat, but it's a threat to the very social bonds that make us human as social animals, and that we need to function effectively in the world, psychologically, socially, economically, etc. So I think that you really start to see some challenges there, because folks don't have, as Mark's pointing out, those usual mechanisms for coping, and both the belief systems and the social systems that help them. But yes, I do believe that many great religious traditions incorporate principles that help us live a more successful and adaptive life, including thinking about doing things for others. And so it's not a surprise necessarily that my work, past and present, is showing that it's important for others and for.
I want to ask Anna quickly. So we've seen, we've probably seen, it's probably been incredible the number of scientists that we've seen on TV talking about this, the COVID-19, and explaining that to the public. I don't know if I can think back to kind of the number of times that we relied on scientists to kind of to give information to the public, rely on them for information also. Can you talk some about kind of how that's changed the dialogue on an issue like this, and the communication and the dialogue around kind of communication of science to the public, and them using sometimes not just in plain language also, but in language that people have to learn new language also, you know.
I think that's been a really important part of understanding the pandemic is translating the science to the mainstream public. Each discipline, my discipline, everybody who we've heard today, each discipline has a particular jargon. So for instance, when Tara said prosocial, that's part of her vocabulary. She doesn't have to think about what that means, but I didn't know what it means, and she stopped and explained it to me. So that's good, because prosocial actually sounds like other words I do know, and so I could guess at a meaning and I would be wrong. There are some jargon words that I think others would have trouble guessing at. So if I said anaphora and we started talking about anaphora, my assumption is that I'd be the only one on the panel who knew what that was, because it has to do with poetic structure. But when we say something like mutation, that means a very particular thing for virus. And yet we also use that term colloquially in conversation. And in that context, it has a lot of negative effects. So when we hear someone talking about the mutation of the virus, our predisposition, our assumption is that, oh, that's a bad thing. Mutations are bad things. And that's what Ed Young's latest article in The Atlantic was really dealing with, this difference between mutation and strain, which the general public doesn't really make a distinction between, but scientists really do, and that mutations are expected in viruses. And so I think the real problem with communication, when we hear a science word that we don't know we don't know it. But there's all this language that overlaps between science and our colloquial everyday language. And I think that's where the confusion really starts to emerge. And so I'm really glad that there are a whole bunch of science writers out there correcting the confusion and trying to do the translation work, because scientists can take this stuff for granted, and I take things for granted in my discipline. I think we all do, and being teachers really helps remind us that we know things as experts and not everybody else does.
Yeah,
Thank you.
The impact of social media and the realm of language to social media and that outlet is one that is confounding to me, and I'd love your perspective in the sense that, as a healthcare provider and a scientist, I could spend all day, if I got on social media, correcting all of the wrongs that I see out there from my lay person friends that are not scientists and not healthcare providers, that they are sharing and continuing to share and agreeing and really kind of building this perspective that appears so far off. And yet I know that my science background will only carry so much weight on social media, because it is a whole different style of communication and the perspective of the group as opposed to the individual. And that piece has really been puzzling to me as a healthcare provider, and how to I turn the social media off, because I've realized I can't right the wrongs, and I can't correct what is, a perception that's not willing to be changed.
Great. We have 2 minutes left, so I'm going to give everyone a last word and ask you one final question to kind of wrap up, and give you 30 seconds to answer that question. I know that's a challenge. So if we're looking at kind of the balancing act that we're playing as in our society right now, it's a balancing act of reopening the economy and our social lives, frankly. That's the way I open this Ask the Expert, and maintaining the health of our community also. We don't want us to go backwards also. What are the keys to that from your perspectives? You all are experts from different perspectives. What are the keys that you look at when you're trying to answer that question? So Mark, we're going to start with you.
Okay, so I think that, you know, the issue is that you have to figure out, you have to, I mean, I think they have to open up to some extent. Okay, I mean that's where we're headed, and we're already starting to do it. The issue is you have to, I mean, it's kind of it's a difficult question, because you want to open up, but at the same time, you can't let the open up to the extent that the number of COVID cases explodes and we have New York City all over again. And that's the real challenge. That's the real balancing act, is that you have to open up, but you can't open up to a degree where you're gonna have a second wave that's worse than the first one. And I think that's a tough balancing act.
Great. Tara, you're up next.
I agree. I mean, I agree with Mark that, you know, we have to open up to some degree. We can't remain in the holding pattern that we are, you know, that we've been. But at the same time, if not much has changed in terms of our ability to address the threat that's out there. And so if we risk a second wave that is worse, then I think we're not really thinking about the long-term consequences. I mean, all the things we're thinking of protecting, we may lose, and lose bigger than we have thus far if we're not careful. And so I think we need to, you know, use the best facts available to us to try to figure out how to engage and when, and what that will look like. And remember that these are people we are talking about. You know, it's easy to see the stats scroll by on a computer, on a TV screen, but they're real humans with real lives. So we have to be mindful of that.
Anna, you're next.
I would agree that this is a balancing act. I think one of the, well, and I would also say that I'm not an expert in these particular areas, and I think we have to be careful about going well beyond our areas of expertise. But one of the things that I think we have a sense that we've lost is ritual. And so no matter what the next steps are, I think creating rituals for our new context is really important. And ritual, of course, has very much to do with poetry, but also with religion, which came up earlier. So I think that's what I would say.
Great, thank you. And Dan, you get the last word.
All right. You said I have 30 minutes to answer this one, right? You know, yeah, absolutely. You know, what I struggle with is, to me, as a healthcare provider, you know, we let people smoke even though we know smoking kills, right? And so part of what I believe in opening up a country again with this is that people come into it with open eyes and an appropriate understanding of what the risks are that they're entering into. And the challenge that we face today is that, you know, being able to share correct quality information that is science-based and you know, grounded in a health aspect is very difficult to do and get people to buy into and trust. And it's almost to a point where individuals will take a certain perspective and do the opposite just to try and prove the scientists wrong at this point. So I think that that's the biggest challenge, is when can we get to a place where the science can drive a decision and the masses to some degree will believe the science.
Great, thank you. And thank you all for your excellent questions. Thank you for participating. A special thanks to Joey Anderson, John Schneider, Terrence Droop, Pamela Uzel, and my daughter Grace Piechota, who were all behind the scenes helping out with this amazing presentation. These presentations will all be posted online on our website, so you can download those materials if you want, and feel free to contact the experts. The video recording of this will be posted there also. And then we're going to have another one of these on May 19th. So look forward to that and hope you can come back. So with that, have a great day, stay safe, and we'll see you next time.